My name is Robert Bandera. I'm a family physician with Monroe Clinic in Freeport, Illinois. I decided to go into medicine. I love science, and I also liked working with people. When I was in high school, I liked taking all the science classes, but then when I went off to college, I actually initially thought I would go into biomedical engineering, but then when I started looking at what biomedical engineers do, I realized I did not want to be in a lab all day. I did do some lab work when I was in college, and it was a good experience, but I did not enjoy working just in a lab. I actually liked working with people. So when you're looking at a problem-solving issues and working with people and working with medicine, this worked out quite nicely. When selecting a doctor, what I would look for is someone who I can communicate well with. And so doctor has to listen to you, and so they have to be able to listen to you and communicate back with you, and people can have a strong knowledge base, but if they can't communicate what needs to be done and looking at treatment options, and perhaps there may be more than one option, what works best for an individual. I think the community benefits from Monroe Clinic, partly the resources that are available with specialists. It's great if you have to send a patient to a specialist, whether it's orthopedics or neurology or dermatology, and they are coming down to Freeport. And that makes things a lot less stressful for patients. You know, when you explain to a patient about they may need to see a specialist, then they have to start thinking, okay, how do we get there? And if their person who needs to go there is older, then they have to worry about transportation. And actually physically getting into the building can be quite a challenge. It could be kind of an adventure. And so when you're able to have the specialist come down to Freeport and see the patient, that is really helpful. Sometimes you see kind of when you explain to patients that the specialist comes down to our clinic, you see relief on their face. Like, okay, that's much easier, I can do that. I enjoy bicycling. I really enjoy backpacking. Hiking is great. I enjoy camping. My family doesn't like winter camping, but I enjoy winter camping, no bugs. The canoeing and kayaking, we live close to the Rock River, and as long as it's not too shallow, we can get out on the river. Winter camping, put a tent up in the snow. It's fun.
So do you go alone since your girls are not into that?
I can't get anyone in my family to do that, but I do. My family does like to snowshoe, and we also cross-country ski. And one thing in the wintertime, because daylight is short, put some headlamps on and go for a hike or go snowshoeing at night, which is great because, especially if you're out in the country, just turn off the headlight and listen and see what you can hear. You usually can hear coyotes in the background or see what sort of animal tracks you see.